So I'll also introduce our next speaker, my esteemed co-chair, Professor Rob Thomas. He's a consultant oncologist at Addenbrooke's and Professor of Nutrition and Exercise at Bedford University. And he's going to talk about inflammation and COVID and some very exciting things that we're really looking forward to.
Thank you very much. And a clap at the beginning, that's always good. It's sort of indirectly related to aging, but I hope it fits the theme. So I'm lucky enough to run a research lab, a lifestyle research lab linked to Cambridge and Bedford and a few other places. So I'd like to tell you about some of the research we've been doing. So look, you know all about the microbiome, and certainly if you've been on the British Society of Lifestyle Medicine microbiome course, you'd be more of an expert than I am. But we know that the microbiome is extremely important. There are trillions of bacteria all over our body, etc., makes up half our genetic material. In Cambridge, there's a microbiome signature research lab, and every month they're discovering new strains of bacteria. So, there's things we still don't know about it. A lot of things influence it, and it molds our immunity, it molds our age, rate of aging, and the risk of cancer. So what I'm actually going to talk about today in this afternoon is how the microbiome affects cancer development, how it affects the rate of progress if you've got cancer, how you can respond differently to cancer treatments, what side effects you get are influenced by your microbiome. And the biggest disruption to cancer services in the last 2 years has been COVID. So that's what I've included in this talk. So if you have a poor microbiome, are you more likely to get worse COVID, long COVID, and more recently, what's the chance of you getting a good response to the vaccine or side effects to the vaccine? There was a paper published last week in the BMJ showing one of the biggest factors related to the COVID vaccine is your microbiome. So I'll just start with cancer development. So what are the mechanisms? If I was explaining to another doctor in the staff room, what are the mechanisms of a microbiome causing cancer or affecting cancer? Well, there's lots and lots and lots. I'm just going to give a sort of whistle-stop tour of these. So first of all, one mechanism is if you have a good microbiome, you break down the gifts of nature, the polyphenols or the phytochemicals, which are the components in food, as you know, which give it its color, its taste, and smell. And if you have a good microbiome, you break them down into absorbable units and have a better effect. And we know that polyphenols have a number of anti-cancer properties. They help dampen down excess chronic inflammation. They improve epigenetic expression of the healthy genes. They slow the glycemic index. They improve DNA repair, and they help with oxidative pathways. So they're not direct antioxidants, but they help improve the efficiency of oxidative pathways. So what are the other important things? Well, good healthy bacteria help to break down the soluble fibers into butyrate and other fatty acids, and these help to feed the gut cells, so they make the gut healthier. And so it's less likely to be inflamed, it's less likely to have gaps in it, or the nickname for this, as you know, is leaky gut. A lot of the immune cells in the Peyer's patches also get damaged by a poor microbiome. So there's less immune surveillance. You don't identify pathogenic bacteria as well. And of course, if you have a leaky gut, you get nutrients leaking out into the bloodstream. But more important, you get toxins coming into the bloodstream, which weren't there otherwise, and your body then elicits an inflammatory response against them. So you have this chronic excess inflammation. Now, it's a sad fact of life that inflammatory cytokines actually drive cancer cells. We don't know why, but they drive cancer cells. And obviously, they damage tissues and collateral tissues. So that's important. And there's lots of other factors like the effect of pH. It lowers the pH in the stomach where it should be lower, and it makes it more alkaline in the rest of the gut, which actually helps protect you against carcinogens. If you have nitrates within food and a good microbiome, it converts the nitrates into nitric oxide, which is healthy, and not into carcinogens, amino carcinogens. The other thing which is less well talked about is that it's very important for a microbiome to absorb vitamin D. And the best probiotics, for example, have vitamin D in them, and vice versa. We know that vitamin D, independent of the microbiome, is very important for cancer. You're more likely to get cancer if you have low vitamin D. You're less likely to respond to treatment. And I do a lot of prostate cancer active surveillance and things, there's emerging evidence now if you have low vitamin D levels, you're more likely to progress from active surveillance into active treatments. And all these things get worse as you get older. We know that the diversity of the microbiome gets worse as you get older. You get more pro-inflammatory bacteria and less anti-inflammatory bacteria. And then because of this, you then get this perfect storm of cancer development. You have less DNA repair. So if you then get some mutations developing, your body doesn't identify them. You get less immune surveillance. So if you get a cancer cell forming, and we all have them every day, you're less likely to pick them up and kill them. You get more chronic inflammation, more oxidative stress, and then, as I said, more carcinogens. So all that together means you're more likely to get cancer. So coming on to response to cancer treatments. Now, this case is very sad, and it really just sums it up. This was a lady, I think she was German, who was given a PD-L1 inhibitor. Now, we're using these drugs more and more. They're immune therapies which uncloak cancer cells and make them recognized by the immune system. So it's our own body killing the cancer cells, but these drugs just help the cancer be revealed to the immunity. So, of course, if you have impairments of your immunity, they're less likely to work. But, and this is, and it's a sad reflection. Every day we use these. Now we're using them in breast cancer, lung cancer, myeloma, and I would probably say 20% of the patients going on to immune therapies. What happens is you've got 2 minutes to see a patient, you say, here we go, take the tablets off, have a nice time. This is a classic case. This woman was given them. She then fell to pieces. She had lung toxicity. She had profuse diarrhea. She ended up in ITU for 6 weeks. She actually did respond, but she had to stop treatment due to toxicity. She was not offered anymore, but she decided to take on herself to adopt a lifestyle medicine approach. So she did lots of research, and she did all the things to improve gut health effectively, which I'll come on to. She was retried the PD-L1 inhibitors. She had a good response with no toxicity. So the question is, why wasn't she offered that before she had it in the first place? And nobody is, not even now. And of course, there's lots of data now coming out, which I've already just mentioned, that if you have better gut health, you have a 40% increased chance of responding to immune therapies. I mean, that's a massive improved response. So coming on to cancer progression, this is harder to prove, actually. But there are data from active surveillance, which I've mentioned. These are people with prostate cancer who you can watch without giving interventions initially, and if they then show signs of progression, you treat them. And it's come clear that if you have when people start progressing, if you look at the microbiome, there are changes which occur before they progress. So there's a bit of a chicken and egg here. Is it that the microbiome changes because your cancer progresses, or the other way around? And it's still not really known. So this is one of the studies we're starting soon. And we know that giving phytochemical-rich capsules to people with prostate cancer slows the PSA progression. What we don't know is if an intervention to improve gut health could further slow progression and reduce resistance to androgens. So we're basically giving everyone we're giving people a phytogenic capsule, and we're randomized to a probiotic or not, and we're measuring PSA over the next couple of years. So that'll hopefully may have the results for you next year. Coming on to treatment side effects, cancer treatments actually cause damage to the microbiome. So it's a sad fact that we're damaging people's microbiome. It could be that they're putting on weight, they're taking steroids, the chemotherapy or the radiotherapy itself. So it's we must be vigilant to that. We also know that after cancer treatment's finished, they might have had a course of chemotherapy or radiotherapy or whatever, they are much more at risk of developing chronic degenerative diseases. Now, if you look at that list on the left, which are chronic degenerative diseases related to poor gut health, they're almost identical to the diseases you get after chemotherapy or radiotherapy or hormone therapies. So although you can't directly link them, it does make perfect sense. And in my practice, I say to patients, look, if you want to go off, I'm not going to see you again. One of the most important things to concentrate on is to improve your gut health. I'm not going to tell you how to improve gut health. Again, you know more than me, but most doctors haven't got a clue, I have to say. But so just concentrating on eating more prebiotics and some bacterial-rich food and stop eating sugar and exercising more would be pretty much in a nutshell. Is there a role for probiotic supplements? Well, there are some studies looking at chemotherapy, particularly capecitabine and 5-FU type drugs. Radiotherapy, there's some trials showing it reduces side effects and certainly reduces the risks of hospital-acquired infection and reducing the risk of viruses. Of course, viruses, COVID, etc., are a big disruption to cancer treatments. You have breaks in treatment, and it makes treatment less effective. So this is why I'm coming on to COVID. We're all familiar with the gut-brain link. You're more likely to get fatigue, neurodegenerative disorders. But there's actually a gut-lung link. The microbiome of the lung is very important for how you respond to viruses and other illnesses. You're more likely to have autoimmune diseases, such as asthma, and if you get a cold or an upper respiratory tract infection, you're more likely to get the severe consequences called ARDS. And we know from people who've examined the exudates of people with COVID that you can actually find abnormal or pro-inflammatory gut bacteria in the exudates of the lung. So they've migrated there through the bloodstream, as well as, of course, having its own microbiome, which is more pro-inflammatory. And that leads to this excess exudate formation, which is ultimately the thing which becomes fatal. So it's your own body immune reaction against the bacteria which kills you. So what do we know so far about the microbiome and COVID? What's been published so far? We know that people with poorer gut health are more likely to get worse acute COVID and more likely to go on to develop long COVID. We know that COVID itself damages the gut as well. So you can be perfect and you get COVID and your gut health changes. But we didn't really know till this time last year whether an intervention, if you have COVID, to improve your gut health could improve outcomes. We got some inclination from the King's app study, the large app study, which looked at, they asked people what they were taking, what their lifestyle was, and then subsequently whether they developed COVID. And there was some evidence that people who took extra vitamin D or probiotics had a reduced risk of getting COVID. But that's not a prospective study. So we decided we couldn't do any cancer studies in our unit, so we decided to direct our efforts against COVID. So we put a trial through Essex. I have to thank Captain Tom, who indirectly funded us. He came to our hospital, unfortunately died in our hospital, so not a good advert, but he was quite elderly, and we were grateful to him anyway. We thank all the people around Britain who know a lot more about probiotics than I do, who came up with the formulation for the trial. And this is what it looked like. So we recruited people with COVID, symptomatic COVID, and we randomized them basically to, we started randomizing to have a probiotic or not, but we had to stop because we couldn't recruit anyone who wouldn't take the placebo. So we ended up giving everyone the probiotic, and we then randomized a prebiotic formulation with phytochemical-rich foods against placebo. So it's not the trial we would set off to design, but it was, in research you have to be pragmatic and do what you can do. And we basically looked at cough, overall well-being, fatigue, and GI symptoms. And we were very pleased to report, and actually going back, most of the people in the study had had symptoms for over 100 days. So we didn't know we knew that the symptoms persisted for a long time. There wasn't a definition of long COVID back then, but actually it became a long COVID study. So when people had the intervention, there was quite a dramatic improvement in symptoms, in the majority, about 70%, within sort of 2 weeks, which the statistician felt, in view of the length of time they had COVID, was statistically relevant and certainly welcomed by a patient. And if you took then on the randomized section the prebiotic formulation, there was an even greater, there was a threefold further improvement in symptoms. So we're very pleased. It was very highly significant. It had a lot of exposure in the BBC. I don't know if you saw all the stuff in the media. Interestingly, and not surprisingly, people who had a poor characteristics likely to be associated with a poor gut health at trial entry, such as males, older people, history of indigestion. And on the ward rounds we were all doing at 6 in the morning on COVID wards, it was very obvious that people who had a long history of having gastroscopies and history of indigestion seems to be more of them. Again, not really a surprise. This is nice that there was 2 other studies very similar to this using almost identical probiotics, and pure coincidence, none of us spoke to each other, and they all showed the same thing, that mainly lactobacillus probiotics seem to reduce the risk of COVID, which is reassuring to see that you're not sort of standing alone. What about the vaccine? Now, obviously, we should all get vaccinated. I'm not anti-vaccine at all. But, it's not been quite as successful as we thought. We're all having to get more and more vaccines. Why are we having getting more and more vaccines? Because immunity is not lasting. Now, why is it not lasting? Well, we don't know the answer to that, but we do know. Again, there was a paper published last week saying that people who have poor gut health are less likely to respond to the vaccine, and more importantly, they have side effects from it, which can be a bit like long COVID. So that's already been published. We know that, so it's almost failed the people who need it most, if you think about it. So, giving it to a really fit person with good gut health, they're probably getting less benefit than someone who's actually got poor gut health to start with. So we need to sort of reverse that. And we know that lifestyle intervention factors can improve your response to the vaccine. But can we improve our gut health, have the vaccine, and get better outcomes? Well, we don't know. We know for the flu vaccine, there are some intervention studies. If you have probiotics before a flu vaccine, you get better outcomes. And that's been proven. This is a very good meta-analysis of the data. We know that exercise before a vaccine can help, although that's largely based on animal studies. And we know being vitamin D deficient reduces your risk, reduces your benefit. But ultimately, we don't really know for COVID. So this is a study which we've managed to get through ethics. It took 8 months to get through ethics, and it was rejected 3 times. And in the end, we did an exercise intervention in the study, and that was a thing which we had to pull out because the ethics committee rejected it. Now, don't tell me why they get upset with exercise, but this is the world of ethics committees. And if anyone's in the audience who were on the committee, thank you very much. So we are recording exercise, and we're telling people to exercise, and we're doing exercise, proper formal validation, but it's not a prospective study. The only prospective part is they're given a probiotic, and they start a week before their vaccination, and we do baseline immunity, baseline vitamin D, and we do the same at 8 weeks. And again, we're recruiting really well by coincidence because there's now a whole new batch of boosters. So we've got about 50 patients in already, so we're hoping to get all the results by Christmas, and I'll tell you about that when the results come. So thank you very much for listening. It's a bit of a quick stop. If you want to email with any questions, please do so.